Hi, everybody. It's Sarah, the host of Unmuzzled. Thank you so much for being here. I'm begging StreamYard to please change that countdown music because it used to be really upbeat and it made me ready to go for my podcast. And now it's putting me to sleep. And I don't know why they changed it, but please, I'm begging you. Presenting sponsors, by the way, one of our presenting sponsors is here today. I can't wait. Hold on here. Thank you so much to our presenting sponsors. Yucca Fence is a family-owned, trusted provider of high-quality fencing solutions with over 57 years of experience. They take pride in protecting what you love the most and give back to rescues, shelters, and humane societies through their partnerships. They give you a free, no-obligation estimate and use the highest quality materials. For transparency and peace of mind, visit Yucca Fence for all your fencing needs. Canine Cruise is the place to take your pet. They offer dog and cat boarding, dog daycare, pet retail, and mindful day school. Tons of indoor space with a huge yard. Canine Cruise is your one-stop shop for professional pet care in Chicago. Kiki's Corner Natural Pet Foods in downtown Winfield, just a block south of CDH Hospital and the railroad tracks. Kiki's has all your food and health aid needs for dogs and cats. Kiki's Corner for a healthy, happy pet. Sniffing out a new vet? Bond Vet is a new breed of vet care that offers everything from primary care to walk-in urgent care visits. And right now, they've got a special treat for our listeners. You can use code UNMUZZLED to get $50 off your pet's first visit by booking at bondvet.com. That's code UNMUZZLED at BONDVET.com for $50 off. Make sure you use that code. It is not often that I get here on this podcast a vet that can answer our questions and actually answer my burning questions, which you never know what that's going to be. But I wanted to first, hey, Dr. Morton, welcome to the podcast. And he is from Bond Vet, our brand new sponsor.
Hi, thanks for having me.
Yeah, so I heard that you're a Lions fan, and that's how I'm going to open this up because, this is Bears country around here.
Yeah, I was born and raised in the Detroit area until recently. It's actually really funny because whenever you meet Bears fans, they're like, oh, I get it. We're Bears fans. And I'm like, don't pretend to know my pain.
Right.
You guys have been to a Super Bowl in my lifetime. The Lions have, before last year, the last time the Lions had won a playoff game, I was 11 years old.
Wow.
So
the struggle is real.
Yeah, the struggle is real. And that was the only one they'd ever won in their history. And I barely remember it because I was 11.
Yeah, so you got to hope. You got to just hope for every year, once camp starts, once those OTAs start, it's like, all right, we have hope because, there's no record right now. So yeah. I love it.
Well,
sweet. So, yeah, that was my icebreaker football for you. I live in Arlington Heights, and I'm hoping the Bears don't come here because it's going to become an absolute nightmare. But now, every week it changes. It seems like they will be coming here. So we'll see what happens.
Well, is that where they're planning to build their new stadium?
Yeah, that's one of the options, either that or the city, but they're running into all kinds of barriers with city issues and policies and space. I mean, the biggest thing is space. If you've ever been to Soldier Field, which I have many times, even for a concert, it's impossible to get out of there. And really in there, it's a nightmare. But yeah.
Well, I've never been there, but it sounds like parking would be a nightmare because I know, where it is. And
yeah,
there's
bad.
Never good places to park.
Yeah.
That's the city in general, though. Is you can sum up Chicago as where can I park? That's
right. It's so true. Anyway, back to Bond Vet. So how did you grow up knowing that you wanted to be a veterinarian and help animals?
Oh, no, so veterinary medicine is I've had dogs and cats my whole life, and pets in general. I've had several rats and mice, but veterinary medicine is actually a second career for me. So I didn't go to vet school until I was in my early 30s. And I actually moved to Australia in the middle of the Great Recession because it hit Michigan a little bit harder, a little bit earlier. I should say. So around 2005, there was just no jobs, and that's when I graduated my first time through college. I was working in advertising for a while, and I hated it. So I went back to my high school job, and I was like, I hate this too. Like, why am I, I was waiting in suites at the Palace of Auburn Hills, which is where the Pistons played.
Wow.
And I was like, why am I doing this? Like, so I moved to Australia with my partner at the time. And we just lived there for a year. And like Australia just has all sorts of fun wildlife. And so I was thinking about going into a job in animals, like going back to school for some sort of animal degree, whether it was in like marine biology or, you know, zoology, just something. And started working at a vet hospital when I got back. And, started at first doing their marketing and then kind of moved and started taking classes, and everyone just I just told everyone that I was just taking classes just to take classes. And then my girlfriend let it slip to an uncle that I was trying to get into vet school, and he like kind of doubted me that I could do it. So like the stubbornness in me just kind of fueled me through the rest of the way. Uh, so I can't imagine myself doing anything else. Like the vet medicine does have a high burnout rate, and we can talk about that if you want. But like, I mean, for me, I just want to play with other people's puppies, right? Like that's kind of like my life goal.
I mean, you're proof that you don't have to stick to the route that you had planned, right? I mean, you can have almost a second go at life and doing what you love, which is also what I did. I quit my job in sports and TV, and I decided to run two businesses. Now, was it hard? Is it hard? Yes. But like, I now know like that was the right thing to do. So kudos to you, number one, for that. And yes, we are going to talk about the compassion fatigue that goes into vet med with not just veterinarians, but techs and like front desk. I mean, there's so many people that run a vet's office, and I've seen it so much more now that I run Live Like Rue. But for you, and this is, I was kind of looking at Bond Vet and how it's different and why it's different. I think the key is number one, providing urgent care along with primary care. So can you tell us, how that part of it works, which is so important to people?
Well, so, and that is one thing people don't understand about vet med in general is like they'll call up their vet and they'll be like, I have an emergency. And they'll be like, you have to go to the emergency room. And it's like, that's like calling your pediatrician when you're having a heart attack. Like, it doesn't necessarily make sense. So we do try to have like a little bit more urgent care focus. We have oxygen therapy, mobile oxygen. We can handle a lot more of your urgent cases. We don't hospitalize overnight. So like there is the possibility that we still may send you to an ER because you may come in with your case and I may say this needs 24-hour care. Like you may have a parvo puppy or something like that, and I'm like, I want you on fluids and antibiotics and antiemetics. But for the most part, like if you come in and you're like, oh, my dog's limping, like okay, we can get you in today. Because we take same day appointments, we take walk-ins. It's not something that every vet necessarily does, right? And that's something that's not necessarily understood. Like everyone thinks that a veterinarian should be able to handle everything, but so I actually started my career in vet med in emergency, and then moved to GP, and it blew my mind when I realized that there were people in general practice that can't unblock a cat because like it was second nature to me. And if you came to me now, like I can unblock your cat, but you may end up going with your cat with an urethral obstruction that you may go to your GP and they may have never been trained to really handle that. It's not something that we all can do. So Bond Vet does handle, you know, a little bit more in-depth cases than, you know, maybe your normal general practitioner.
And I assume too, for you with that emergency experience, getting into an urgent care vet, you were probably a huge asset because you already had all of this background of dealing with emergencies or urgent care.
To be fair, I am an excellent veterinarian, but we are in short supply. So right now it's like just I mean I can get a job pretty much anywhere. Like, but I do like the, you know, a little bit more fast-paced environment that we have when we're in urgent care. There's like a fine line between, you know, seeing enough to where, you know, I enjoy my everyday life and like burnout, right? um,
Yeah.
so like I like, you know, people coming in with their limping dogs or their blocked cats or, you know, dyspneic dogs, anything like that. And then I do like I absolutely adore my puppies and kittens. Like, right, like that's what my job is all about. Like I want to see, you know, I always say I'm into other people's puppies. So OPP, I'm down with OPP.
I mean, you need that to balance it out, right? I
Yeah,
mean,
absolutely.
really do need that. So I heard that you're a Frenchie expert, and my pet care business that I started, my pet care business was supposed to be like a side gig. Never ever say that something is a side gig because really it's not. Like it always should have been seen as a full-time job because it is. My clients are literally my family, but I have so many Frenchie clients. And there's two kinds of people. There are people that are like, oh, Frenchies are the worst dogs. You've seen the TikToks where, you know, people will say Frenchies are doodles and you have both, which is
Yeah.
hilarious. But there's also the people that are just Frenchie obsessed. So they are a very specialized breed and mostly because of their medical. So how did this fall upon you? I know the one that you have was an owner surrender or a medical mystery, and you ended up with her.
Well, so is this like, do people see the video of this? Because she's right here.
Yeah, I want to see her. Oh my god, I want to squeeze her. I'm obsessed with them.
She's actually, she's just like chilling. Anyway, so she was actually from a breeder, but the breeder is for the most part a responsible breeder. I won't get into my thoughts on breeding. But she couldn't sell her because she had medical issues. So she was like, if no one wants her, I'll just put her down. And because I mean, breeders tend to see their dogs as a commodity. Like she's not going to put money in to fix her. And she can't sell her. So, you know, if someone wants to take her, I don't agree with it. I understand it. Anyway, so I ended up with her. She has epilepsy. She has a condition called lymphangiectasia where her body doesn't absorb fat properly, which means she's on a very special diet. And she has all the typical Frenchie issues of skin problems. She has had airway surgery, so I had that corrected, which she still snores. And she still farts like a 600-pound man.
I mean, that's amazing though that you took her. I think it says a lot about you. You obviously, you know, care so much. And yeah,
there was a time where I had 3 of them.
Oh, that's like heaven for me. I love that.
I love anything with a smushed face.
Okay, got you. So you like pugs?
Yeah, but Frenchies I have a real soft spot for.
I love that. I also heard FIP cats, and I would love. I've had a lot of cat people on here, but number one, why is that kind of your jam? I heard people come to you for that, and can you? Because I think a lot of my listeners don't understand what FIP is, so can you briefly explain it?
Yeah, I actually cover like the full story of how I got into covering FIP cats on my podcast, Vet Med for Idiots by Idiots. Shameless plug. But FIP is a condition called feline infectious peritonitis. It's actually a coronavirus, so similar to like COVID-19. Most cats tend to be born with it, and it mutates in a very specific way. And it was formerly 100% fatal. Um, I was working in South Bend. That's where I used to practice. And a receptionist came up to me and she was like, "This client's calling. She's not a client with us, but her cat's struggling to breathe." And I didn't know this at the time, but this was someone who used to see me like part time because she lived closer to another vet, but she had a lot of animals. And she would come in with like her rescues or her fosters. And I was like, "Bring her in." She comes in. I walk into the room and I'm like, "Oh, like I know you." So I'm looking at the cat and I diagnosed her with FIP. And at that time, the cure for FIP was to put him down. Um, I had literally read the day before a scientific article from Dr. Pedersen out of the University of California, Davis, where he had done a study that said it cured him. That client happened to read the exact same article, and she was like, "This is my favorite cat." It was sketchy to really treat it at the time. Like, I had to be very careful about what I was actually doing because there's like I couldn't recommend certain things. Everything that the client was getting, the client had to get. Like I couldn't help them, but I could run diagnostics and teach them like how to give injections. And I had to be very careful with my wording and my notes because technically what she was doing was illegal at the time. Um, and because of that, I just kind of became the FIP vet in the area. So people the word got out and FIP cats started coming to me. At that time too, it was 2020. So the place I was at had stopped taking new clients.
Wow.
Except for ones that called and wanted to see me for FIP cases,
Wow.
which was kind of cool because I'm just a general practitioner. Like I don't want to say I say just, but that's condescending. Like I'm a doctor, right? But like I'm not a referral doctor. I'm not a specialist. And like I was getting referrals from other veterinarians. That's kind of cool. It's a little bit of inflation of my ego, I guess. And yeah, all these people were coming to me, but I worked with a different doctor who had come from another hospital, and someone was texting her and she was like, "Will you ask Dr. Morton about this?" And I was like, "Why does she want to talk to me?" And she's like, "She said you're the guru." And I'm like, I don't like, I accidentally got into this. Like it was completely by accident, but life hands you these things, right? Like, so over time, it became my passion. It is now, as of last summer, it is now legal. And over the years, I've helped other vets and coached them. And I mean, it's a formerly 100% fatal disease. And I've gone and helped cats live like full lives after recovering from a 100% fatal disease. And that's really why you get into vet med, right? Like these cats it's also mostly infects kittens. So these cats were dying, and through, what appeared at the time to be practically magic, I helped kind of give them a second life. And I wouldn't change that for the world. It's really become my passion. That first client took all of our data that we had collected and submitted it to a study that strangely Newt Gingrich's wife had kind of been a part of. And I went to a conference, and me and that first client are good friends now. So I have her on social media, and I went to a conference and I was going to the FIP lectures because I was like, this has kind of become something that I do a lot of. So I am humble enough to admit that I don't know everything. I should listen to what people who study this are saying. And I went to this lecture that was a 3-hour long lecture on FIP, and that study came up and was presented to me, which is the coolest part of my career so far, because like I said, I don't do research as a part of my career, and as a general practitioner, I got to be a small part of helping other doctors, understand a disease that's devastating to cats, and be a large part of helping it get fixed. And that's, just like a wonderful part of my career.
I mean, it's incredible because you could have just said, no, but it's awesome. And it's awesome that the owner advocated for her pet. I think sometimes people, give up too soon, but to say like, hey, like this, I will do whatever, like I will do whatever you tell me, to have that in the palm of your hand. I mean, you were set up for success, to be honest.
And that owner, I will say, she did all of her own research, and she sent me an email, and she was like, if I go down this, like, will you help me? And I was like, let's do it. Like, she said it's her favorite cat. And Mallory just hit her 5th FIP birthday, actually.
Wow.
Yeah. So
that's so cool. I love that.
Every now and again, like when you work at hospitals, like a student will come through, and this is another really rewarding part of my career. So there was a veterinary assistant who was in college going to vet school. Eventually she was applying, and she was a part of that case, and she's now a veterinarian, and she was texting me because she was treating an FIP case, and I was kind of coaching her through it, and I was like, you don't need this, like and she was like, trust me, I'll take any help you can get. But even that was really rewarding, because she was with me on the very first one, and now she's asking me for help. And so like, I can help develop other vets and doing this. And like I said, it's a nice thing.
Yeah, incredible. That is what a story. I mean, amazing. And again, you never know something that's going to fall into your lap, or you can change, the course of what has happened in the past. It's awesome. So this is kind of the tough part. So, euthanasia, every time I have a vet on, I talk about, okay, you go to the room with the puppy and then you have to euthanize a pet. Our vet, so I had adopted a broken Chihuahua, 3 pounds, ended up as a stray. And, he was, when we got him, he was 12. When he died, he was 16. But, I kept him with the same vet for consistency. Even when we moved, I would drive back to the city. And Dr. Bean, I'll just mention his name. I won't mention the vet since this is a sponsored part, but he came into the room to euthanize Mac sobbing. I mean, that's how much he cared. Mm-hmm. He said, this is the first time I've ever cried. You guys mean so much. We were some of his first clients, mm-hmm. bringing him this old broken Chihuahua, and and he ended up moving Lakeview, but all these doodles and all these, and then we bring him this broken Chihuahua, and he loved Mac so like as much as we did. So it's hard. It's like such a hard thing. And for us to see how much our dog meant to him, because he saw him, even though we didn't have him through his whole life. And a lot of your clients, you see through their whole life. But how hard is that aspect of it? I mean, it's obviously hard, but to try to, put on a brave face, going from tough appointment to then the puppy appointment, which you probably need right after.
Yeah, that's actually an interesting part that you brought up, is people don't realize like that aspect of it, right? Like, there's I'm in a room putting down a dog and, feeling with an owner, and I have to clean myself up and go into the next room and be like mentally prepared and whatnot to handle the next client. That's actually the most difficult part. I will say euthanasia's become one of my favorite parts of the job. People can have a real like visceral response when I say that. I get it. Like no one likes death. Death is hard, but if I do my job well in those moments, I can be a real helping hand to that owner. And a good veterinarian can make that a better experience for you. It's never going to be easy, but that is something that I do pride myself in. One of my, um, I, the dog's name was Gibson. He was absolutely one of my favorite patients, and this is years ago. So the fact that I, remember this dog still like tells you a little bit about that. But um, I loved this dog. He was an old pitty, and he would sit in front of the drawer that I had treats in and just bark at it until I gave him treats, and like literally down to the day that I put him down, he was still barking for treats. But he had gotten liver cancer. I was fortunately the one to diagnose him with that. And those owners came in, and they couldn't handle being in the room. So I told them that was okay. We sedated him first. He fell asleep. They left. And then like years went by, and I never heard from those people. And um, uh, I got a puppy appointment, and I didn't recognize the name. And um, uh, sorry, sometimes these take me a second. Anyway, so I didn't recognize the name at first, and I walk into the room, and the owner's like, "You might not remember," and I was like, "No, you're Gibson's owners." And she like was a little taken aback at first, and she was like, you really did well by him, and I never got to thank you. And she wanted me to be the vet for her new puppy Luna. And then Roxy was her next dog, and I saw them for a while too. I moved from South Bend after a bit of a messy life problems that we won't get into, but like stuff like that again, that makes my job worth it. The harder ones are because like those moments when you euthanize a dog, like people, I had one client when I was in emergency. This was really early in my career, and she had gone to her religious figure. I can't remember like what denomination she was, and he had told her she'll never see her cat again because they don't get into heaven. And she's telling me this, and I was like mad for her because I was like, that you just went to that person for comfort, like like they can't prove that. Like, how do they know this? And like, but that cat was dying. I helped it. I didn't kill a pet. I ended its suffering. And that's like really like how it should be seen. People see it as like you're ending a life, and it always breaks my heart when people say they're sorry during those moments. And I always tell people, don't tell them you're sorry. Tell them thank you, because you're not apologizing for anything. You're helping them. The ones that absolutely crush me are the ones that don't let me help them. And I tell a story about this golden retriever that I had seen. It came in on emergency, and it had been diagnosed with an enlarged spleen like a year ago, according to her history. And if you know anything about enlarged spleens and a golden retriever, it's practically a death sentence. And if you don't do anything, the dog probably lives for about 2 weeks. She came in on emergency. Dog had been diagnosed with an enlarged spleen. It was struggling to breathe. We took an X-ray, and it had like no lung tissue left. I told her like it's really time. And she said, the last doctor told me I'd get 2 weeks, and I got a year. So I'm going to take this one home, and I'm going to pray. and I got a note the next morning, and it it just said, like, he had passed away at home. And I know that, like, I could have helped him, and that's like really what it boils down to for me, is like that one hurt, because I know he died, like, not being able to breathe, drowning in his own body tissue. And those are the ones that I struggle with.
Yeah, so hard, especially when they suffered. The thank you line, I'm so glad you kept going, because I'm like, I can't come back on camera right now. But that's such a great way to view it. And I mean, I don't think we look at it that way, because you just feel so bad. And you shouldn't. You should be, thanking them for coming into your life, which is, if you are like me and your pets are your life. I mean, they really,
Oh,
you don't have
yeah.
kids, this is it. So again, this is a little bit trigger warning, depression, that kind of thing. But 80% of vets are diagnosed with clinical depression at some point. We've seen the articles about suicide rates. So obviously, taking everything into account that you just said, and how hard that part of it is, what do you do for to deal with compassion fatigue, because you are immersed in this every single day?
I have a great therapist.
Good.
And like, to be honest, like, what do I do with compassion fatigue? I don't know. Uh, I definitely go through it. Like I said, I can't see myself doing anything else, and so there's always like that next appointment that is like the Frenchie puppy, that I'm like, okay, I just had that awful appointment. Now it's on to a puppy or a kitten who just has a crazy personality. Or I recently had just a really nice review on Google, because this woman had gone with her kitten to a couple different vets, and she said they couldn't figure out what was wrong with her. And I diagnosed it with FIP, and we got her set up, and like, that cat's alive and doing great, and that owner thinks I'm wonderful. And like, it's those things that keep me going. And I've just always been a very empathetic person. So you can't pour from an empty cup. Fortunately, I have like one of those water coolers.
I feel that. I definitely feel that. And you got Dude the Doodle. That's
Yes.
that guy.
Dude.
Tell us the story of him, because again, you had look at him. I can't. What is his story? He ended up with you too. He's like, you guys. This isn't my normal podcast crowd. Sarah's on the other end there. But yeah, how did you end up with him?
He was hit by a car,
Oh.
actually. So and he was about 8 months old. I've always said my house is a home for cripples, bastards, and broken things. It's a Game of Thrones quote, but all my dogs are some sort of like dog that wasn't gonna make it and needed me. So he's my bionic dog, though. So he actually had a surgery called an FHO, which is femoral head osteotomy. That's where they remove the femoral head, because he had hip dysplasia, but he has a pin in his SI joint, which is where your pelvis meets your spinal cord, because he had a SI luxation, which is where that you can't walk if you don't pin that, because it's part of the weight bearing access. I'm trying to be as little technical as possible.
No, that works, yeah.
So like, he just needs a pin there. He has a permanently broken pelvis, like, because your pelvis, you don't need most of it. Like, it's actually, the body is incredible. Like, it's amazing how little of it you actually need to just keep humming along. So he was broken, and the owner was like, I think I just have to put him down. And I was like, well, I mean, I'll put my own money into him. And thousands of dollars later, he's had all this surgery done, and he's my ride or die though. Veterinarians will regularly have a conversation that if we like died at home, how long would it take us? Take our pets to eat us, and for the mutant, probably about 20 minutes. And people say, dude wouldn't, if he ever did eat me, he would still feel really bad about it.
Oh.
Because he's my ride or die. He'd be like, Dad, I'm really hungry. Can I just have a bite?
He's so cute. I love him. And you can tell your dogs have the best life. I mean,
Oh,
so
they're good dogs.
yeah, it's awesome. That's how we get through all this, right? That's the key. Thank you, Dr. Morton. You are amazing. Everybody get to Bond Vet. Now, like, look, you can see right here the kind of vets they have. FIP cats, Frenchies. I mean, you have it all. I know you deal with it all, but those are
my hoodie has a Frenchie in
it.
it.
I noticed. I'm like a new Frenchie person because I have been in rescue so long. Frenchie rescues are very not common. There is a Frenchie rescue actually around here, but they don't go into shelters a lot. Usually people scoop them up pretty quickly, but it takes a special person to understand that breed. That's for sure. And I definitely am still learning, but they are magical creatures. That's all I'm going to say. I know you agree.
They are just, if you buy a Frenchie, realize like you're buying a problem.
Yeah. Medical.
One of my mentors always said, if every breed disappeared tomorrow, except for the French Bulldogs, vets could still make a very nice living. But I don't recommend them because I'm a veterinarian. But if they come to you and Muti's my heart dog, so she's always been very special to me, and like when she does end up crossing like the Rainbow Bridge, there will be a part of me that dies too.
Yeah.
But that's because like she's been like with me through it, and you're special too, buddy.
And you will say thank you at that point.
Yes, I will say thank you. Although she should be thanking me. Do you have any idea how much her medications cost?
Hi, dude. He
wants to say goodbye too.
Bye, dude the doodle. You are spectacular. I love your rainbow mohawk. Oh my God, he's cute. Thank you, Dr. Morton. You've been incredible. I really appreciate your time. Let's get you back on again.
Oh yeah, anytime. I'm always willing to come on and talk.
Okay, awesome. Have a great day.
You too.
Everybody, Dr. Morton, and we didn't even get into this, but the other thing that's great about Bond Vet is the aesthetics are very calming and pleasing. So if you watched my podcast a few months ago, there was a vet that does a lot of holistic vet, and everything in there was purple. Like when I was doing the interview, everything was purple. This is how it is. When you walk in, it's comforting. It's not sterile. There's not like a ton of white. Like it is like you're almost waiting in your living room for the vet appointment. So, and I'm so happy to have them as a sponsor. Just amazing. Speaking of sponsors, supporting sponsors, you're up. Thank you to our supporting sponsors. On the corner of Montrose and Troy in Chicago's Irving Park neighborhood, you'll find a hidden gem known as Templestowe Pub. They have a great selection of local draft beers, and the Malort is always flowing. Oh no. Join us for a charity bingo event or a tap takeover with a local brewery. Don't want to leave your dog at home? All good, bring them along. Whether you're throwing darts or playing a banger on the jukebox, you're guaranteed to have an awesome time. So head on over to 3135 West Montrose and look for the old style sign. The Canine PT is Chicago's highest rated dog physical therapy clinic, and they're dedicated to enhancing the lives of your four-legged companions as they age or when recovering from an injury. Give the gift of pain relief to your furry friend. They also offer a discount for rescue dogs. For more information, visit thecaninept.com. Intuitive animal behavior dog training, positive reinforcement, force-free and fear-free training solutions for every dog. Jenna offers individualized training, behavioral boarding, shelter support, and positive reinforcement board and train services. Creating an environment that is happy and healthy for your pets is so important. For more information, go to intuitiveanimalbehavior.com. Thank you, supporting sponsors. Thank you, presenting sponsors. Thank you, Bond Vet, for your sponsorship and providing us with a vet right at our fingertips for questions and comments. Dr. Morton, we appreciate it so much. Thanks, everybody, for listening and watching. Have a great night.